Recording in progress.
Just allowing for some more folks to join. Yes, yes. In the chat, just let us know where you're joining us from. All right. All right. I'm gonna go ahead and get started just with our a nice jam-packed hour of a wonderful panel. So I'm Josh Johnson, he, him, with the Alliance. I am just introing our fourth webinar in the Housing Focused Street Outreach series. This is focused on promote health and safety as a core component of overall strategy of addressing and ending unsheltered homelessness. Before we get started, as you see, we have the chat open, and we encourage you all to, be respectful in the chat. We aim to create a diverse and space that invites all voices, right? But in order for us to do that, we have to agree not to utilize any discrimination or abusive language, because our goal is to create a safe but yet brave space that allows for us to disagree and have exchange thoughts, also really uplift and hold the humanity in each other, right? So let's share thoughts. Let's be in community, but let's do that in a way that is respectful and trauma informed. If you have questions, please use the Q&A box. You'll probably see that a few times in the chat. If you have questions, use the Q&A box. We'll have some time at the end to answer those. We will highlight and share with you all accompanying documents. You'll have some case studies from the communities who are sharing today around what they're doing. So you'll have some of that actually in paper form on our website. We'll put that here later on. You all are muted. Use the chat to communicate, and the webinar is recorded, and the PowerPoint can be made available upon request. Again, the webinar is being recorded, and the PowerPoint is what can be available based off request. So if you aren't familiar with the Alliance, we're a national organization that is committed to ending homelessness through our three main efforts of work, which is our policy and programming work that really uplifts the work that's needed with our policymakers through advocacy, utilizing first level advocacy, also working with the Homeless Research Institute that really analyzes data and identify trends and strategies to help improve the work that we're doing. Then we have the capacity building team that I am a part of that works with communities individually to promote and provide training, that system training to improve interventions like street outreach, utilizing what we learned from our research team and what we understand and advocate from our policy team. We all work together, woven in with the voices of folks with lived or living experiences of homelessness, while utilizing strategic communication with the goal of inspiring faith, leading with love and equity, and ultimately working to bring everyone home. So I'm just going to quickly say why Housing Focused Outreach framework. We're in this moment where the current reality must change, right? We have unsheltered homelessness in communities across the country. National viewpoint is increasing, and that reality is we have to do something. And so with that understanding, we have developed a framework that really gets at creating practices that doesn't necessarily only address homelessness and meet the needs of folks experiencing unsheltered homelessness, but actually works to do what we're funded to do, is actually end homelessness for the people we're serving. And we also know that the longer people experiencing homelessness on the street, the the more there's symptoms of mental health or substance use or physical health, those things increase. It makes it harder for folks to stabilize the longer folks are experiencing unshelteredness. There's shelter that people actually want to use, and there's housing resources, affordable housing, right? We know that there's a need for universal guidance. There's a lot of folks doing different, approaching outreach in different ways. So how do we have a unified and uniformed approach to how we address unsheltered homelessness through outreach? We also know that outreach serves the most vulnerable. Outreach is an intervention that is unlike most interventions, because most interventions people are actually going to it. Outreach is going to the highest acuity, highest vulnerable folks who are not attached to our system and attempting to provide resources and services. And we also know that we work better together. The more coordinated, the more effective we can be with actually addressing homelessness. With these realities, right, we're seeing things in the news around like how the approaches to address homelessness, but we ultimately know that ending someone's homelessness requires us to be unified, us to recognize the humanity, and us to actually work towards ending someone's homelessness by providing housing. So we developed this housing-focused street outreach framework that So one of the things that we did was we defined what a housing-focused street outreach is. Really, it's an engagement strategy that prioritizes connecting people experiencing unsheltered homelessness with life-saving, person-centered, culturally responsive services and resources while actively securing stable and permanent housing. This approach is characterized in 5 core elements. We have to use data to measure and ensure that what we're doing is impactful. We have to have strategic collaboration for other outreach providers, other homeless and housing providers, but also general public, general mental health and AOD and other upstream partners. Ensure that we can maximize our impact. We also have to be person-centered with our engagement. We have to promote health and safety, right? A crucial piece, right? We have to ensure that the safety of not only the people we're serving is factored in. The people who are doing the outreach are healthy and safe, and also the general community as well, right? But that can't be the only piece of the outreach. That has to be a part of a continuum, because if we only focus on that, we will not actually end or address homelessness. So the last one is ultra crucial, because while we're doing those other key elements, we have to be housing focused and anchored in a housing first approach to actually end someone's homelessness, right? So these all five key components have to be a part of our housing focused outreach framework and accounted for and when we do this work. So again, today we're going to focus on promotion of community health and safety. It's really, I'm going to do a really high level before we talk to our phenomenal panel. It's really focused on comprehensive preparation, utilizing purposeful engagement, intentional coordination and communication, and being able to be trained and understand how to manage conflict while performing outreach. Coordination communication consists of really maintaining clear location awareness for your team through technology, through constant communication, having consistent ongoing engagement, right? Ensuring that people know where you're at, when you're going to be where you say you're going to be. We have to have collaborative coordination, meaning we're not outreaching whenever possible by ourselves. We have to have a safe and supportive team environment, meaning that we're looking out for each other, understanding when our coworkers are not in the best of space, or we're being accountable to one another. Then we have a universal communication and transparency policy, which really talks about how do we ensure that what we're doing, the work, is actually being communicated to the overall general public. Because I'm sure I'm preaching to the choir a little bit here, but a lot of times you are doing a lot of great work, but the general public does not understand the work you're doing. So how do you create dashboards or like hotlines or communication strategies for people who have a concern to call, and then also see exactly what's happening as far as where the outreach is happening and the impact it actually has. And then the 9 keys for purposeful engagement really focuses on gathering information, really in being intentional about our introductions and like when we meet new folks, ensuring that we're working with in pairs, we have the necessary supplies, we're working and choosing high visible areas when appropriate, understanding and ensuring that we respect personal boundaries of individuals. No matter where we're doing outreach to, when someone's sleeping, that is their home, so we have to respect it as such. We have to lead with honesty and transparency and choice with the work we're doing. We can't coerce our way out of homelessness. And then we have to, trust our own intuition, right? We are the, sometimes our intuition will tell us when it's time to maybe break off an engagement and come back later. We have to be able to trust that as a part of of our engagement strategies. All right. So I really did like a 5-10 minute spill on what I'm talking about. If you go to the actual framework, you'll see tons and tons of pages and information. Really focus on diving deeper into these elements. So I encourage you to look there. But also in the meantimes, I want to introduce our panel. I'm going to pass to Samm, who's going to facilitate this wonderful conversation. That's going to go in more detail into like how do we promote health and safety when doing outreach, and also like and what impact does it have on the overall community and the people we serve. So Samm, I'm going to pass it to you.
Thanks, Josh. My name is Samm Williams. I'm from the Connecticut Coalition to End Homelessness. Outreach is also near and dear to my heart. I've done it in my past work history, but we're not here to talk about me. We're here to talk about the topic at hand and our wonderful panelists that we have lined up for you all today. So we have Caty, Tara, and Ryan, and I'm going to let you all introduce yourselves with your name, your organization, and a bit about the work that you do in the outreach experience.
I'll go ahead and go first. My name is Caty Schmitter. I'm a program manager with the San Diego Housing Commission, which is a housing authority that administers contracts for many of the City of San Diego's homelessness services programs. I've had the pleasure of working with street outreach programs for the last 6 years at the Housing Commission, and then also doing some training with them when I worked before that at San Diego COC and HMIS lead. I did data entry training. So as somebody working at like a funding agency, my lens is a little bit different than somebody working on the ground, but I have gotten to work really closely with outreach programs for years, planned design programs, and worked on service delivery and improvement. And it's changed a lot in San Diego in the last 10 years. I absolutely love working with outreach teams because I really think that outreach is the heart of the homeless response system. And it does what no other intervention can do. It literally meets people where they're at to ensure that no one is left unserved. So really excited to be with you all. Thanks.
Thank you, Caty. Tara?
Good afternoon, everyone. My name is Tara Immele. I'm the Director of Outreach and Crisis Services at Greater Cincinnati Behavioral Health Services. We're a community mental health agency, a community behavioral health agency. But under the umbrella for me is 3 separate teams, one being Path Homeless Outreach, which Path teams are present throughout the country, as well as one outreach team that's specifically located in our inner city, and that's kind of paid specifically by an entity in the central business district. So it has its nuances, but also a lot of effectiveness. And then one like essentially low-key crisis management program that works with emergency services. So a lot of different nuance, but encountering a lot of folks who might be actively experiencing behavioral health concerns, as well as primarily folks experiencing homelessness.
Awesome. Thank you so much, Tara. And last but certainly not least, Ryan.
Hi, Ryan Fieldman. I lead an outreach team, a small team in West Virginia. We cover 44 counties and provide street services to folks in a really diverse continuum of care, I'd say. Yep.
Okay. Thank you all. Again, appreciate you being here with us today. So we're going to start off with like the big picture of it. Talking about like community and systems levels approaches. We can start off with Caty. Quick question. How would you say that we can create coordination with our feeder systems, like healthcare, criminal systems, legal systems, and able to strengthen those outreach efforts?
Yeah, that's such a good question. So I currently work with a program in San Diego that's operated by Path San Diego, and it's called the Multidisciplinary Outreach Program. And what they do is they focus on folks who are really considered, very high acuity, often chronically homeless, multiple co-occurring conditions. They're also identified, the target population is folks who are high utilizers of the criminal justice, emergency medical, healthcare, and homelessness services systems. So interacting a lot with those feeder systems that you're talking about. A lot of these folks are calling 911 multiple times a week, right? Taking ambulance rides, unfortunately, because they're not connected to the right primary care providers or community supports that they need. And so one of the things that's happening is the outreach team is really working super hard at coordinating with places like an ER, right? When somebody is hospitalized. I think it's really challenging. I mean, that literally looks like, which I'm sure everybody on the call is really familiar with, you're calling that hospital social worker every day because you want to make sure that that planned transition for a client to a skilled nursing facility happens. You don't want them to be discharged without having touched base to make sure that they're actually going to go where you've been planning and where you've been coordinating. And it really looks like the hard work of literally calling every day and making sure that when shift change happens or a new social worker's in, you don't end up losing that person's next step. So I think a lot of it is that I think there needs to be more coordination. I also think that, accessing shared data sources, which we have some up in San Diego with 211's Community Information Exchange, you can look at data on individuals' interactions with police, with law enforcement, with healthcare systems. And so that's really helpful. And then I think one other piece that we've really seen help is in the city, we have community care events where outreach workers can bring individuals to what's like a one-stop shop where we see a lot of different systems. So healthcare, we see homeless court represented, behavioral health, veterinarians, there's all, often there's on average 26 different providers and they're able to serve people and, get that DMV application processed, connect to Social Security, get cash aid or EBT, and do that all in one-stop shop instead of having to have the outreach worker travel to all those different places over the course of 2 weeks and maybe get an appointment, right? Instead, it's all right there and accessible. So that's been helpful, but I do think that there's a long way to go in coordination in San Diego, and I'm sure that's not, we're not unique in that.
Very nice. Thank you, Caty. So it sounds like there needs to be a lot of like coordination going on and really getting the community to shift their perspectives when it comes to outreach homelessness and the work that you all do. So Tara, do you think you could touch on like how can outreach teams help shift public perception around safety, especially when it comes to a real threat versus a perceived threat when it comes to serving our populations?
That is such a good and nuanced question that I will just barely scrape on. But I think a couple of things to note. I know, again, preaching the choir here, but I do want to stress that the typical unhoused and unsheltered folks that we tend to work with tend to be at a much higher chance of being victimized or exposed to violence than the general community. And I mean, I don't know what it is about the summers, but these things tend to amplify, and our folks also tend to not use resources, not make police reports, all those other things, just layers on layers of vulnerability. So a lot of times when we speak safety, it's always a challenge. Or trying to have the perception of health and safety, it's always a challenge to both show the different stakeholders. Clearly, as a clinician and leading outreach teams, we're trying to wrap around the individuals, and that is very much the case. But also when it comes to working within our social services system, homeless system, broader community for opportunities for education and transparency within reason of what steps we're doing. Because I think when the lay person, I tend to call them, if they have more information about how we work or what we're doing, it just helps destigmatize. I think it helps understand some of the work going on in the background. And it's hard because privacy is really important to me, and that or important to me for my programs, and that we're not going to spell out everything that we're doing with somebody, but to really demonstrate like, hey, we are doing steps behind the scenes, or that with this clientele, we might have to do a lot of steps before you as an outsider can really perceive anything. But so that's the opportunity to really try to engage those system components. And then when it comes to health, and just also sharing stories. I know we all not hate, but doing the media thing can sometimes be challenging. But sometimes there is a time to show it, bring in media and bring in certain scenarios to show the warm and fuzzy scenarios, or show demonstrate some of the efforts done, to show like the humanization. Because I think as soon as we otherize people, then they're the homeless, drug addicted, violent folks. Obviously, I'm saying that not in a literal manner, that are in the encampment in the woods, and they're going to come get me and my family, right? So there's a lot of aspects about health too, and also with collaboration, we can improve ways for like sanitation, work with maybe when it comes to bathroom components, when it comes to getting rid of trash. And, unfortunately, this is a reality, but nonetheless, using resources. I know our public health entity will help come clean up dirty needles, stuff like that. So we want to always bring on everybody we can to improve health and safety for absolutely everyone. And that ultimately, if those things happen, it does help the other side too.
Nice. Thank you so much, Tara. So I know you spoke on like what that looks like when it comes to shifting the perspective for the people that we serve, and really trusting and having those community agencies come in and be more knowledgeable. So my next question would be to you, Ryan. Would you be able to touch more on what does that transition look like? And for your area and your coalition, how do you create and ensure a safe and respectful, warm handoff when it comes to connecting our vulnerable populations to services or community resources?
I mean, first and foremost, we're there with our program participants when the handoff occurs, if that's what they're comfortable with. I mean, unless they say we absolutely don't want you with us, we'll hang out, and hopefully that helps them feel comfortable meeting the new person, getting through that initial that stage of, because oftentimes when we're doing a warm handoff, it's a really dramatic change for the person. They may be accessing medical care that they haven't accessed in a really long time. It could be a mental health appointment that they're kind of, working through some ambivalence about, or it could be MOUD or some type of substance use treatment. When folks are being housed, my staff never misses an opportunity to be there for the move in, and to help. And we take about 2 weeks, 3 weeks to kind of set boundaries, kind of make sure that we're continuously reiterating roles and responsibilities. And I was your outreach worker. Now you have a case manager, and they'll be helping you with this, and this. But 2 to 3 week period, once the person transitions into whatever the service is, to kind of stay in communication and reinforce those new boundaries, and kind of just help to impart knowledge about the new person's responsibilities and how they can be of assistance moving forward. And I'm we do agency-wide trainings to make sure that everybody is on the same page when it comes to that. But also we have to send little weekly reminders or monthly reminders to staff, especially folks that are new, but even some that are seasoned, that maybe aren't strictly adhering to that expectation that we set. Because I think it is the best thing for the program participants, and we want to see it in action, not just in writing.
Right. Thank you for that. And speaking of, it kind of helps shift into our more like organizational practices that we can talk about next. What would you say, like, what does it look like to effectively onboard staff? I know, Tara, you mentioned having like a large team. So what does it look like, especially when it comes to de-escalation and safety? What does that look like for effective onboarding?
There's a couple different things, but one thing, and coming from a community behavioral health organization that might have some benefits. We have in-house trainers for CPI, Crisis Prevention Institute, which is an evidence-based practice. I'm not going to say that is the end-all be-all, but that is a really good starting point that I want everyone within their early stage of of their employment to go through, so that you can really be a little bit more in depth rather than saying like just, oh, here's some tips,
Mhm.
a little bit more practical application. So that's my biggest thing I stress is just that type of training and then trying to reinforce it. I know a lot of times the training's like, oh, training's done, check, move on. And these are things that need to be reviewed, whether individually or in teams or in the field or what have you, as time progresses. So I think onboarding around that, and as staff get up and moving, they get to really see some of their veteran staff. That's usually also something that's been really, really powerful. You have somebody who is very good at what they do, and as they hear other folks do it, they're like, man, I just want to act like so and so. Somehow they have a great way to really be able to step away from stuff. And that's another thing I think a lot of our folks just they want to help. They want to help. They want to fix things. They want to get involved, and empowering staff around. I'm not saying don't do your job, not be appropriate, but there are situations and times where you need to, and this is my last formal terminology, shut it down and leave, because sometimes that is the best de-engagement. Sometimes is the best move for that moment. Doesn't mean you don't engage and say hello a couple days later,
Right.
but really empowering staff that you do not have to, by any means, manage a situation that is unsafe, and how to always have an exit plan. And then one other thing I really want to touch on is both teamwork and communication. Obviously, all the nuance, all the cliche things, but one thing that one team we work with does, which I absolutely love because we partner with a medical outreach team, they have a terminology. If anyone ever says yellow highlighter, they're supposed to all be like, all right, we're cautious. We need to start maybe moving out of the situation. And if somebody asks for a red pen, they're getting out now. So because they have a different structure, they have and they have rotating staff, so you may not always have the nonverbals to be able to look over to your coworker and be like, "You're ready to go." They have a more explicit terms to cite if there is a reason to make a quick exit.
Okay, nice. I'm going to let everyone give a little feedback on this question. Caty, would you like to share any input on that?
Sorry, just finding my mute button. And would you repeat the question, Sam?
Sure. What would you say effective staff onboarding looks like, especially regarding de-escalation and safety training?
Yeah, I mean, a lot of the things Tara mentioned, honestly, I think we see our programs utilize and are really important. I think, onboarding and even kind of starting with a hiring about really making sure that folks understand the kind of work that they're signing up for, both how rewarding it is, but then also the setting they'll be working in, right? Because, as you all know, outreach is difficult work that is done on the ground. You're not going to be working a 9 to 5 in an office, right? And so making sure that folks are aware of that and that you really discuss what that looks like. And I know that for some of my programs, it even could go as far as, okay, yeah, these are all the rewards that come with this work. Also, this is, today I was at somebody's home because our outreach workers are able to actually do post-placement when somebody's housed. And, he's struggling a lot right now. And that means that there is paper stuck to the ceiling with ketchup. And I literally can't navigate my way through the apartment because, unfortunately, there's some hoarding kind of recurrence coming up. And so really talking through that, because you want to find the folks who are ready to dive in for that sort of thing. That being said, I think in addition to just like hiring and really being transparent about how amazing the work is, but also how challenging it is, I think the right kinds of trainings. And then what we found in San Diego has been really helpful is focusing some more on trying to provide some community-wide in-person training. So we did this for some of our shelter systems, and looking to do with outreach as well is having on the ground, de-escalation training and cultural humility that is done with trainers, and that there's role playing in person, because a lot of our programs have fantastic onboarding and they have online trainings that they can access, but that really practicing those skills in person and sometimes with other programs, right, and other nonprofits where they can kind of learn from peers they may not otherwise have an opportunity to interact with, can be really helpful.
Nice. Thank you for that.
I'll touch on one. Hey,
Yeah,
sorry,
there you go.
I'd already unmuted because I never miss an opportunity to run my mouth.
There you go.
One, I completely will mirror everything everybody has said thus far, but I think we've been looking at asking a few more behavior-based questions or scenario-based questions in the interviewing, because I think it starts with really hiring somebody that you feel is good at assessing safety, and making good decisions based on their observations. And so I think
Absolutely.
it starts there, and then it's a continuation of, and I really like some of the literature that you put out recently about looking at terrain. Am I going to be going in vacant structures? Am I going to be going downhill? Is there other kind of geographic obstacles that I'm going to experience out here in West Virginia? We definitely have, like that's why I said we're diverse, because we could be scouting the hills and hollers, we could be on the streets and alleyways, we could be in kind of areas where there's been a lot of flooding lately. So it's kind of an ongoing process to say what's been going on in that area. Let's talk about it in our weekly one-on-ones, and let's make sure that our staff is making good determinations about what they're doing, where they're going, and who they're meeting with,
Mhm.
so that not only they are safe, but the people that we're trying to serve are in safe situations as much as they can be. Um,
Okay. And since you brought it to that direction, also, you bring up a good point, which leads me to my next question. Um, what kind of shadowing and early support do you think would help new staff build confidence and resilience in different atmospheres?
So one aspect was touched on already, and I'd taken some notes. But getting my staff out with folks that are seasoned, or they were referred to as veteran kind of staff members, not only in outreach, but some of our housing stabilization team. So interdepartmental shadowing, because not just outreach habits. I like my staff to be able to pick up other
Mhm.
administrative habits, and play off the strengths of their colleagues. So we do a little interdepartmental, we do, peer shadowing, and then the supervisory shadowing kind of happens a little bit down the road. I kind of will step back and follow for a couple of days,
Mhm.
and do overnights when I have to travel, and then we'll critique at a later time. I'm actually hoping to develop almost like a scorecard, so that I have just not just verbal feedback, but some written feedback from my staff that they can, some of them, I think, digest a little bit better when they have time to sit and read and think about those interactions and how they could grow and improve. Or it's always exciting when they get positive feedback, and
Mhm.
so.
So if you had someone where it was seemed like you had either one of your veteran staffs experiencing burnout, or if you could tell from one of the new hires it was like a high stress or too high impact worked for them, how would you address that?
So I mean, actually, kind of was reviewing some of your literature as well, that you released recently. But I mean, we can have discussions about capacity, and how that's affecting their overall mental state. Is it too much work? Is that what's
Mhm.
causing the stress? Do you have too high a caseload? How can we manage that while also meeting the needs of the coordinated entry system? Because there are weeks when my staff get hammered with referrals, and then also
Mhm.
they're picking up more and more participants through their canvassing efforts. So we do a weekly check-in, and we also have kind of an open door policy or an open phone policy, because we're all remote workers. If someone's having a challenging moment, challenging day, I mean, they can text me and say, I need to speak with you immediately. I just had a really concerning interaction, or I'm just really stressed out right now. And I try to invite that from my team. So
Mhm.
I do encourage healthy boundaries too, but letting them know I will make time for them if they need to talk is really helpful, I think.
Absolutely. Couldn't agree more. Um, and I know, Tara, you mentioned the yellow highlighter and the red pen, like kind of alert phrases. Do you have any guidance that you can share on knowing when to walk away from an engagement for like the safety of everyone?
Obviously there's a lot of scenarios where you're like, yes, leave. But I mean, I think first and foremost is to train and try to have staff as much awareness of surroundings as possible. Because that decision might be different on the side of a sidewalk downtown versus we had to go a third of a mile in the woods and under the underpass to get here. So what the surroundings look like, what the extra strategy looks like, right? But I mean, big picture environmental factors. I'm usually actually less, I mean, I'm not actually, but I'm less usually concerned about the folks that we are targeting to engage than necessarily others. The stereotypical, maybe we're talking to 2 or 3 people who live at this encampment, but there's another encampment, like they're kind of neighbors and the people are floating around. Or especially in a more urban environment, we're talking to somebody on the street, but then how many other people are walking by, and sometimes if there's interrelations, whether protectiveness or you're the person you're speaking to, their enemy walks by and they start getting into an argument. These things all happen. So I guess to me, it's just any trigger or awareness that, hey, the tides might be turning here. Or the whole concept behind if we can come to a resolution, like where are we at today with what needs to happen? Like if
Right.
you did what you need to do, or sometimes we do have clientele that get very, very angry about something that's outside of our control, and we want to process that with them. But there are situations and times where we're not going to come to a productive conversation. So just to kind of really try to pull it down, reiterate, we are here for you. I'm sorry you're feeling this way. Can we talk about this tomorrow? And then to then get out of this situation.
Nice. Thank you for that. And Caty, I was wondering if you would be able to kind of share your experience on how you assess the difference between someone not wanting to engage just today and not wanting to engage with your team as a whole.
Yeah, that's such a great question. So the program that I work with that, would have the most direct experience with is the multidisciplinary outreach program. They work with some really high acuity folks, right? And there can be a lot of challenges that come up and a lot of behavioral health symptoms and or just, frustrations naturally that arise in trying to navigate towards stable housing. And I think this does come up frequently for them. And I think one of the things is just getting to know people, first of all, like when is something not going well on a particular day and it's important to take a break and then touch base another day, and getting to know that individual's, patterns, ways of expressing themselves to kind of help navigate whether or not what they're saying is, clearly like, I no longer want to work with your organization versus I need to take a break, right? And try again the next day. And so I think making sure that you give folks space, right? One of the tough things about outreach is you're literally going to their home, right? The place where they're staying is their home. And if anybody just ran in my door and started asking me questions, I would be frustrated. And so kind of acknowledging all of that, making sure that you give people a heads up when you're coming out to see them, schedule a time, give them a heads up when you're on your way, check in, and don't just, don't like tear open a tent door, but make sure that you are engaging in a respectful, polite way, just like we'd expect somebody to knock on our door. And then use all of those tools to try to avoid situations where we get into a situation where somebody maybe doesn't want to engage further in services. But yeah, when it comes about, I think, telling that difference, it really is being smart and strategic and also keeping in mind what else is going on in their life that day, right? What other triggers are happening? Are they having an issue with their housing application or have they been denied recently and are they really frustrated? And keeping that in mind in a trauma-informed manner to be able to really navigate, give them space for those feelings, acknowledge them, and ultimately, I think, take a step back and end the interaction if things are not going well. Ultimately, of course, I think for any program and for the program that I work with, they have to have very clear language around asking, all right, would you no longer like to receive services, explaining what that looks like and making sure that we are always respecting individuals' choices when it comes to that. But I think doing everything they can using their skills, their knowledge of the individual and their relationship to meet their need, take into account what else is going on in their lives and the interaction if needed. But then at some point, if the follow-up does indicate, they want to end services, also respect that decision.
Very nice. Thank you. So now this question I'm going to direct to all of you. And from listening to you all speak, it very much so sounds like really like, listening to the needs of the people that we're serving, really being able to navigate resources that they may not have access to or like engaging them with access and making sure that we're transitioning them in, very trauma-informed and client-centered ways. Can you tell us all about some of those nonverbal things that we're telling them? Not only how we show up listening, but how do we actually physically show up when it comes to engaging the populations that we serve so that we're showing up in an inviting way? And what does that physically look like?
I can lead this one off. I mean, we're very respectful when we approach. Actually, some of our standards are a mirror image of what you guys just released a few months ago, but announcing ourselves clearly and loudly as we approach.
Mhm.
maintaining a safe distance because I want them to feel comfortable and I want to feel comfortable in those environments. And then working our best towards a consistent effort. When we leave, I get on my staff about case notes and I'll say, hey, how come your case note isn't reflective of your follow-up? How
Mhm.
come it doesn't say the last thing a case note should say is what you discussed related to your follow-up? When am I coming back? Where would you like to meet next? What are we working on between now and the next time we meet? Because I think everybody feels safe when they have a bit of a routine they built, when they have some consistency, when they feel like they can trust each other, and when they feel like the person on the receiving end is going to do what they said they were going to do. And I
Mhm.
think that builds a really safe environment no matter where you're at. Bridge, alleyway, tent in the woods, camper with no utilities. We see a lot out here.
Mhm.
Boiler room. It doesn't matter if that person's going to be there and you say you're going to show up. I just think you show up, and when you do, you are very polite about your approach because you never know what someone's doing. It could be something private. They could be journaling. They could be with a loved one. They could be having some private time, in other ways, and you just don't want to startle somebody when you approach. The
Mhm.
safe distance, and sorry if I'm rambling a bit, I think for other reasons, because there was a question on here about working with folks of a high acuity. I mean, there could be a risk of bloodborne pathogens and other things, so that, maybe like the same kind of COVID rule, 4 to 6 feet, kind of meet them where they're at. If you have to crouch down to be polite, if you have to stand up and meet them, if you have to sit somewhere if it's appropriate. Sometimes I'm sitting on a log during an interaction or a
Mhm.
stump or something like that, or on a curb on the street. But I try to keep that 4 to 6 feet just because it puts me in a safe place and it keeps them in a safe place. So.
Awesome. Thank you. Any additional feedback from Caty or Tara before we move on to Q&A?
So yeah, Katie touched on this before, as well as Ryan announcing yourselves, this and that. But I just kind of want to reiterate what Ryan said. It was just so hard for our staff a lot of times to get, but I think just that consistency and transparency in how we show up in our actions, and being that our actions match the intention, that our actions match other things. This is an outreach team, but I once had somebody who was like in a more enforcement capacity, like show up and give a whole bunch of folks a whole bunch, like give them a whole bunch of food and be really excited and then be like, you gotta go. It was very like you can like, that was probably very confusing for those folks because you were just very excitable, very chummy, very engaging, but then also on the other end of saying, I want to be nice. I want, I want to support you, but you have to get off this property. Which, obviously there are times where that was just a situation that had to happen. I'm not saying you should be mean about that, but that can be very, very confusing, especially for our folks who have a lot of reasons not to trust the systems. And that was a small step, but might have added to that, right? So that's just using, and that's some version of that's happened 1,000 times, right? So that would be something I just want to reiterate, as well as, I know going back to basics, and sorry, I've been writing little notes the entire time, guys, but going back to basics, but trying to, depending on your team and your structure, if you have a work badge, if you have a shirt, a hat, other things, kind of labeling who you are and where you're coming from. Again, that consistency, because maybe they've never met that worker before, but they met somebody from that team before, or so that you just know who they're with, because there might be different players, different outreach entities or resources. And additionally, like also the balance of I think a lot of outreach teams are very pragmatic, meaning you're not doing necessarily dressing up, but we also need to be somebody who presents ourselves in a way that can be trustworthy. So there's always, I have conversations with folks of like, yes, you're doing outreach, do not wear flip flops, but also like make sure you're dressed in a manner that if you ran into you, would you want to talk to you? Not trying to judge on appearances, but some level of competency and professionalism. Just because you are working with folks who are in house doesn't mean, we wear sweatpants every day. I know that's a really extreme example, but I think those are all important things to note within this field.
Absolutely. Thank you all so much for that. Such great conversation, feedback, and insight. We're going to take the next 14 minutes to be respectful of everyone's time and move on to some questions that we have from the audience. And whoever would like to give their feedback with answers, by all means, you can take the floor. One of the questions we have here is very interesting. What type of cultural practices are you using in the field? For example, if you come across a Native American, are you offering them resources of places that provide supportive services to Native Americans or letting them know of places that they can go to get mental health services in a culturally appropriate way?
I can lead on this one too. I think I challenge my team members to get to know. We have limited capacity to do what we call community engagement. If you're going to make a referral to any agency, please have someone on the receiving end that you can ask questions about appropriate services. I don't think anybody has a brain like an encyclopedia, but we just try to be cautious. If we're referring somebody, we want to respect their culture and we want to make sure that the agency that they're going to will do the same thing. So even if we have to sit and do some R&D with the program participant themselves until we can find a service that they're comfortable with, that's kind of more our approach than just having a Rolodex of culturally appropriate resources. And the players change at some of the facilities. Some agencies go completely under, new ones pop up all the time. So I think it's about meeting the person again, learning their needs, and then saying, okay, well, instead of just one-stop shop, I'm going to send you here. Let's look at multiple options and let's pick the one that you're most comfortable with. So not rushing into things, I guess, is the point I'm trying to make. Because the last thing we'd want to do is break someone's trust and further, the idea that the system is working against them. So.
Nice. Thank you, Ryan. Caty or Tara, have any feedback?
I think Ryan really covered it, but I think, yeah, just making sure that communication initially is really open and that as you're building rapport, you're getting to know what needs are. I think like every program, the programs that we work with have cultural humility training, and that is helpful, obviously, as part of onboarding, but it's really about getting to know that person and their needs. And like Ryan mentioned, I do think like the players change, services change, so it can be hard to like have an automatic list of somewhere that you would send somebody, but making sure you understand, communicate transparently what that person's needs and preferences are and background is, and then do everything you can to help meet those. And we have a lot of coordination, I would say, in San Diego. We have a weekly outreach case conferencing between all the outreach teams in the city. And one of the goals is that when there's a need that maybe one staff member doesn't know how to respond to, whether it's cultural or something else, that then they bring it up in a call that has, I don't know, I think there's probably over close to 100 staff that we can all kind of discuss, and somebody pops their hand up and says, actually, I know of this new program that just opened up. So I think really tapping into your resource network as well and not reinventing the wheel is helpful.
Nice. Thank you for that. And of course, we're talking about health and safety. So one of the questions was, when it comes to communicating amongst each other or like your team, what kind of tools do you use to accomplish that? I know they mentioned that they use the Microsoft Teams walkie-talkie app, but like, are there any other creative ways that you all keep in touch with each other?
I don't want to plug any one company, but I know T-Sheets does actual geographic mapping when my staff's out in the field. So when they're clocked in, I know exactly where they are geographically.
Nice.
It'll track where they drive, where they walk, and that's all our staff. And then we use Google platforms. So, I mean, we have Google Spaces and group chats and like I said earlier in the training, open line of communication. Um, oh, T-Sheets, David. I'm looking at the chat right now. It's just a QuickBooks time T-Sheets.
Okay.
And then we've had some issues with it to be fully transparent. There's glitches and we have some technological issues. But we do like that feature. That's why we've stuck with it, because I don't think there's another company that's offering that kind of tracking right now.
Okay.
Not one that I'm aware of. And I'm open. If anybody knows, I will let our people, because we'd like to try another one out just to see if it's more effective. So
I'm sure. We're going to switch gears a little bit. How to appropriately respond to sexual harassment from the people we're serving while conducting outreach.
I'll start to take a stab on that one, because that is definitely an imperfect dynamic. But yeah, and of course, like, I'm the first one to say certain things are completely inappropriate, but sometimes, like, from the folks we serve, maybe they're in chaos, maybe that's the exposure they have, etc. Like, it happens. So and I think, like, all sexual harassment can be, like, those things can be different, right? But I assume they're speaking especially like inappropriate comments, catcalling, etc. So we definitely empower a lot of staff to do a lot of boundary setting, have very clear conversations. A lot of my outreach teams work in pairs, so I guess we didn't even talk about that today. So a lot of, like, our more a lot of our visits are just automatically, like, things can go bad safety wise still, but in pairs is a different dynamic, or for whatever reason somebody's really, I don't know why, but it's been a situation where somebody's really kind of being very inappropriate with one pair, even if, like, stereotypically, let's say they're both female but not the other female, so obviously we might trade off on who's kind of the primary conversationalist there. But yeah, definitely a very clear boundary. It depends on where they are in that engagement too, of how hard to hit those things. And then depending on where that goes, there have been times as a supervisor, I've had to pull somebody aside, to have a clear cut, like, hey, we want to serve you. We need to do this safely. I need you to not do A, B, and C, so that my staff can serve you in appropriate fashion. And then we've had times where we just have to keep a lot of space. I don't think we've ever completely closed anybody out, but, like, obviously there are times where we may be a little bit less engaging, less apt to transport, especially without a double of a staff within that. So I don't think there's a perfect solution, and maybe hopefully Caty or Ryan have a better solution, but I think it's just a lot of that. And I hate to say it, but also, like, trying to both acknowledge feelings and frustrations for everybody involved, but, like, also building up staff to have thick skin to be able to ideally set that boundary firmly early on, so that hopefully just kind of squashing it where it's at.
Absolutely.
I mean, I'll just add that from a compliance standpoint, if we did have to move to a sanction, and my staff hates that we add documentation on the pile when we're already doing a ton, but we have what's called an inappropriate behavior reporting form towards staff. We have some a program participant, if they feel like they've been mistreated, and it's the other way around, my staff has done something egregious, they can grieve it and talk to me. But when it's inappropriate behavior towards my staff, if it's text messages, we include the screenshot of the conversation. We've gotten nudie pictures before sent to us, which is inappropriate, and we'll just document. I don't think we've ever moved to sanction someone or suspend them from services, even temporarily. But if we had to, at least from a compliance standpoint, we have some documentation. And if it's not texts or photos, if it's an incident that occurred, I within 24 hours want my staff to document it in writing. And then we just keep it on file in case we do have to move to something. But typically, we do just try to encourage those boundaries amongst the program participants, because oftentimes it could be an isolated incident as long as we're very assertive in our communications about how inappropriate that is and how we need to maintain professional working relationships in order to help them achieve their goals. So, yeah. And that's effective, but it can be really hard for my staff.
Mhm.
We hadn't touched on it yet, but from a trauma-informed supervision standpoint, some of my staff can have a really hard time with that because we have pretty challenging histories. You know what I mean? And that behavior can be triggering to us personally. So, and it's amazing that we don't quickly move to suspend services, because I mean, we are the last stop shop a lot of times for most of the people that we're serving. And if we tell them no, I'm not sure who's gonna step in and help. So just trying to set those boundaries, but it's a learning curve for me and my staff too, because we have to learn to be the type of person that people respect and like I said, it's just it can be challenging. Sorry, I got a little emotional, but
No, it's all
yeah,
right.
I'm really
Appreciate
proud
that.
of my staff that has to deal with that on a daily basis, and I see how it affects them. And
Mhm.
oftentimes, when there is a boundary violation, that is the number one offender when it comes to my staff getting burned out and having a hard time with the work. So.
I don't think I have any like Terry, you had mentioned solutions that either of you have not thought of, but I just want to reiterate too and affirm that like I think the same thing is true, echoing what a lot of what you've both mentioned, that supervision is really important, that support for staff. Ryan, I think we've seen the same things where staff can be triggered. There can be, you know, trauma that is activated by having some of these challenging interactions. And so I think especially for newer staff, it's really important, and for anybody, to have really regular supervision, you know, weekly, bi-weekly, making sure that the supervisor is checking in and asking how interactions are going so that staff can learn to set boundaries firmly and directly and assertively early in their careers and early in their interactions. And then the other thing that I've seen be effective, I think, is transitioning participants when necessary between staff members, right? So if there's just a dynamic that is challenging, that continues to come up, trying to maybe, you know, while we avoid when rapport has been built, transition a situation to another outreach worker before something problematic happens. So trying to really be sensitive and aware and know the team's strengths, and as well as know each participant's unique needs and patterns, so that, okay, if there's, you know, a dynamic that keeps happening every week and there's some really challenging interactions, we're ready to try somebody else and plug that person in.
Awesome. Thank you so much. So just want to thank everyone for joining. Thank all the panelists for participating. I'm going to pass it back off to Josh of NAEH to close us out.
Thank you so much, Sam, Brian, Tara, and Caty. That was such a phenomenal conversation, and all the jewels that you dropped. I do just want to just say thank to all the folks on the call. Just thank you for the work you do. The hundreds and thousands of people that between you all's organization that you've helped connect and to housing and provide those life-saving services. Thank you to the panel, but thank you to the folks who are on this call. The work is hard, and we continue to lead with, you know, person-centered engagement and with care. As Ryan mentioned, we are a lot of times the last group of folks who are going to engage with the folks in our community. So thank you. Here are the contact information for our great panel, so you can reach out to them with questions about their great great programs. And then just one last, just all the things that we talked about is covered in that outreach framework that really focuses on trying to ensure that we're all doing things together, understanding that we're doing all of the core components of working towards a housing-focused outreach approach. And a key part is focusing on health and safety, but it's not the only part. So appreciate all the things that were shared. We have the last of the series happening August 27th, really focusing on housing focused approach. And so you can sign up on our website, the same website you see the framework. And again, thank you so much. Have a great rest of your day. And shout out to our panel for the great conversation. And Sam, thank you for moderating. Awesome job.
Recording stopped.